News Radio 700 WLW.
We got the news of Taylor Hawkins' death, who was the drummer for the Foo Fighters. By all accounts, great dude, amazing drummer, and all that. And a lot of, I guess, where were they at? They were in Colombia.
Yeah,
that's right.
And did you see the first thing was some Colombian official? One of the first things he says is, "Don't blame us on Colombia. It's not because they're here." It's like, well,
apparently you guys have a reputation.
Well, but he had, God, dog, you can't do that to yourself.
Yeah, I mean, a cocktail, or reportedly a cocktail of 10 different drugs in his system. I mean, 50 years old, got a wife and kids at home. I mean, what are you doing? But I want to bring on an expert on the matter. We have a cardiologist joining us, Dr. Farah, or Fahmi Farah. She's based out of Texas. And Dr. Farah, one of the things I'd read that Taylor Hawkins' heart was like twice the size of a normal heart. How does that happen?
Yes, that's called dilated cardiomyopathy. Typically, it happens, in a person who is using multiple different types of substances, different drugs, drug abuse, and particularly alcohol abuse that can all lead to this condition where the heart basically fails. The pump doesn't pump blood efficiently anymore, and over time, the heart just starts getting bigger and bigger because it's not squeezing well enough, and that is heart failure.
So, Dr. Farah, the heart starts getting bigger because it's having to work too hard? Is that what I'm hearing here?
Not necessarily that it's having to work too hard. It's just that when we, with alcohol abuse and drug abuse, our heart muscle can get weak. And, heart is a pump. Its job is to squeeze blood all day long. And when the heart muscle gets weak, it goes into what's called heart failure. In other words, it's not able to pump anymore. The heart becomes very weak. And when it's not pumping, it starts to dilate. The muscle starts becoming weaker and weaker, and it gets bigger and bigger. In other words, it's dilating. So it's kind of like a balloon. It balloons out.
I mean, how long does this take on average to happen? Does this take 20 years to happen, or can it happen in the span of 2 years if you're using a bunch of drugs and stuff?
It can happen very quickly in someone who's binge drinking or heavy alcohol abuse or heavy drug abuse. It can happen in a span of a few months. It can also happen chronically for somebody who is a chronic alcohol drinker. So it can happen over the course of several years, but sometimes it doesn't have to be that long.
Let me ask you this. So if someone has these symptoms and their heart enlarges, and let's say they get it together and they get off drugs and stop abusing alcohol, can things go back to normal, or once the damage is done, it's done?
It can go back to normal, yes. It depends on what stage it's at and at what time period it's getting diagnosed. The sooner it gets diagnosed and the sooner these patients stop the drug abuse and the alcohol abuse and get on appropriate guideline-directed medical therapy, the higher the chance of success rate of them recovering fully from the heart failure. However, if it reaches a certain threshold, for instance, if the heart is twice as big as it was before and it's been there for quite some time, then that success rate can go down dramatically.
So this fella, having seen the toxology report and what Rocky said, I believe it was 10 different things. I want to say that's the number.
Yeah, heroin, antidepressants, alcohol,
cocaine.
Marijuana, cocaine.
Yeah.
Man.
Are you, let's put it this way, are you the least bit surprised this fella passed away?
I am not, because I also looked at the report and I saw how many different types of substances were in that mixture. There were several different types of opioids, heroin, and some of the others that you've mentioned. Those are all highly toxic for the heart. And some of those drugs actually cause heart attack as well, for instance, cocaine. And especially when you combine so many, anything can happen, starting from heart attack to dangerous, fatal type of arrhythmia to heart failure.
And he was not a big guy. And let me ask you this. Would it make it, because my partner here used to be an NFL linebacker. He's, 6'5", 240?
6'4", 235.
Okay. So, obviously, Rocky here is going to last a lot longer than a guy like me or Taylor Hawkins. I think I'm very similar size to him. I'm about 5'7", 5'8", about 155 pounds. So it's obviously going to get to me way quicker than a guy like Rocky.
Yeah, there's
Or
definitely
can
that
it doesn't
component.
matter? Let me ask you this: or does it matter what size you are? You know, it doesn't matter. You can be as big as Rocky or as small as me. Doesn't matter. It's going to get you.
It's a little bit of both. It's not to say that someone who's bigger is not going to be affected by these drugs. They absolutely can be and will be. But the dose may vary. You know, someone who's bigger may require a little bit higher dose, just like any other medicine, like opioids. Whereas someone who's a little bit smaller, they might not be able to tolerate a higher dose. They may have detrimental impact sooner. So to answer the question and to clarify, yes, both a small person and a big person can both be affected with damaging effects to their heart, including cardiac arrest with all these medications very similarly.
Dr. Fahmi Farah is our guest. She's a cardiologist based out of Texas. And Dr. Farah, last question. Look, all these things are bad for you. And we're talking, high cholesterol, poor diet, obesity, drugs, alcohol. In your opinion, is there one of these things that is just in particularly terrible for your heart? Does one stand out over all the others?
They're all bad to some degree, equally bad. Even alcohol consumption, as I said, can lead to heart failure and cardiac arrest and things like that. But out of the substances he has taken, some of them definitely stand out. Heroin is one of them. Cocaine is the other one that can lead to cardiac arrest and cause heart attack. We actually see that quite often. Cocaine patients who have taken cocaine, they come into the hospital with acute heart attack as a result of their cocaine abuse. So, it's hard to say what's bad, and none of them are good. They're all bad. But, yeah, some of them can have even worse effect than the others, including heroin and cocaine.
Doctor, we really appreciate you clarifying this stuff for us. Thank you so much.
You're very welcome. Thank you.